Bismillahirrahmanirrahim. Quote of the day is, the most difficult thing is the decision to act, the rest is merely tenacity. Assalamu alaikum everyone. My name is Dr. Momena Zia. I am a PGI in MPhil Community Medicine at King Edward Medical University. And today I'm going to present the topic of World Health Organization, WHO, under kind supervision of my professor, Dr. Saira AFZAL. Learning outlines will be introduction, mission and objectives, governance structures, WHO key functions, WHO's global health programs and local health programs, WHO in public health research, WHO's role in disease prevention and control, WHO and SDGs, challenges and future direction, and MCQs with key. Participants will be able to describe the aims, functions, structure, programs, and interventions along with answering the MCQs by the end of this session. Moving on to introduction of WHO, it is a specialized agency of the United Nations which is responsible for international public health. That was established on April 7, 1948, which is celebrated as World Health Day. It has various regional offices, but the headquarters are in Geneva, Switzerland. The mission of WHO is to promote health, keep the world safe, and serve the vulnerable, while the objectives are to attain the highest possible level of health for all, address the communicable and non-communicable diseases, strengthens the health systems globally. Now, what is the structure of WHO? It operates under a well-defined governance structure that ensures global health policies that are effectively formulated, implemented, and monitored. So the three key governing bodies are World Health Assembly, which is also known as WHA, Executive Board, EB, or Director General, DG. Now, moving on to the detail of these governing bodies. The World Health Assembly is the decision-making body of WHO and consists of all 194 member states. Meetings, they annually occur in May at Geneva, Switzerland, the headquarters. Special sessions may be called in case of emergencies, for example, in case of COVID-19 pandemic response. Now, Executive Board, it acts as the implementation body of WHO decisions and ensures the execution of the WHO policies. It consists of 34 technically qualified health experts from different WHO regions. The members, they serve 3-year terms nominated by their respective countries. What are the key responsibilities? As already discussed, it implements the WHO resolutions and policies. It also prepares the agenda for WHO meetings and oversees WHO's technical and administrative work. Executive Board is also responsible for making recommendations on public health issues and also examines WHO's budget and financial reports, while providing guidance on global health emergencies and responses. They also have meetings. They hold 2 meetings per year in January and in May. The January session discusses policies, while the May session follows the WHO meeting. Now, the Director General is the Chief Administrative Officer of WHO, which is responsible for its overall management and global health leadership. Currently, Dr. Tedros from Ethiopia is serving as Director General. He has been serving since 2017 and re-elected in 2022 for a second 5-year term. He got elected by process, nominated by the WHO Executive Board and elected by the World Health Assembly for a 5-year term. Now, what are the roles and responsibilities of Director General? Director General leads WHO in global health matters and implements the World Health Assembly and Executive Board decisions, represents World Health Organization in international health forums, mobilizes the global resources for health programs, coordinates with WHO's response to health emergencies and pandemics, and also advocates for universal health coverage and equitable healthcare access, oversees WHO staff and budget. Now, what are the key functions of WHO? Providing technical support and setting health norms and standards, conducting global surveillance of diseases and health trends, coordinating international responses to public health emergencies. Meanwhile, supporting the health policy development and strengthening the health systems and workforce all over the world. Now, there are certain global health programs that have been run by WHO. Number one is the universal health coverage, which ensures all individuals receive necessary health services without financial hardships. Number two is global polio eradication initiative, aims to eradicate polio through immunization and surveillance, as indicated by the name. COVID-19 response and COVAX initiative. It supports the equitable vaccine distribution worldwide throughout the COVID-19 pandemic and afterwards. Mental Health Action Plan promotes mental well-being, prevents disorders, and improves access to mental health care. WHO Framework Convention on Tobacco Control, which is also known as WHO FCTC, it addresses the tobacco use through policies, taxation, and public awareness. We will be discussing this afterwards. Integrated Management of Childhood Illnesses, which is IMCI, focuses on reducing child mortality by improving disease management, nutrition, and immunization. Now, in Pakistan, these are the programs that are present in Pakistan: antimicrobial resistance, blood safety, communicable disease surveillance and response, dengue fever, environmental health, emergencies, essential medicine and health products, expanded program, immunization, gender equity, hepatitis prevention, AIDS, health cluster, health system strengthening, international health regulations, maternal, newborn, child, and adolescent health, malaria control, nutrition, polio eradication initiative, rabies control, stop tuberculosis, tobacco free initiative. So these are the programs that are being run in Pakistan. We will be discussing a few of them in the next slide. So as of February 2025, the World Health Organization continues to actively support several health programs in Pakistan. These programs, they are a part of WHO's ongoing commitment to improve the public health in Pakistan, addressing both the long-standing and emerging health challenges. Number one is dengue control program. So Pakistan has been experiencing the recurring dengue fever epidemic since 2010 with major outbreaks in Pakistan, Punjab, Sindh, and Khyber Pakhtunkhwa. So WHO is assisting the government with vector control, case management, and community awareness by providing technical support and standard guidelines. The efforts include studying the Aedes mosquito, integrating dengue control into malaria programs, advising on clinical management. However, challenges such as 2010 floods, polio, and cholera outbreaks, along with COVID-19, they have diverted resources. Since 2011, dengue control responsibilities, they have shifted to provincial governments following the devolution of the Federal Ministry of the Health. Dengue response activities include capacity building trainings, social mobilization, health education, intersectorial, interprovincial coordination, operational research, legislative administrative support, declaration of an epidemic, financial allocation, and media management. Antimicrobial resistance program. Antibiotic resistance happens when the bacteria change and become resistant to the antibiotics used to treat the infections they cause. So WHO has introduced an antimicrobial resistance program in which they are suggesting handle antibiotics with care. And there are certain instructions on that. Only use antibiotics when prescribed by a certified health professional. Number two, always take the full prescription even if you feel better. Number three, never use leftover antibiotics. Number four, never share antibiotics with others. And number five, prevent infections by regularly washing hands, avoiding contact with sick people, and keeping your vaccinations up to date. Now, expanded program on immunization, also known as EPI, started in 1978. This is the tabular presentation of this program, which includes all the diseases against which vaccination will be provided to children at different intervals of their life, and they will be immunized against these diseases, including TB, polio, diphtheria, tetanus, pertussis, hepatitis B, pneumonia, meningitis, measles, and diarrhea due to rotavirus. This program affirms the commitment of the government of Pakistan to provide safe, effective, and cost-effective vaccination against vaccine-preventable diseases and to set the national standards and guidelines for immunization aligned with the global goals and evidence base and encourage the generation of local evidence for vaccination against vaccine-preventable diseases. Despite all the efforts, Pakistan is third among countries with the most unvaccinated and under-vaccinated children. So for strengthening the EPI services, WHO has supported the development of comprehensive multi-year plans, CMYPs, for federal and provincial EPI programs, and based on it, the PC1s, an annual plan of action are developed. Capacity building is ongoing from mid-level managers to field staff, including vaccinators and lady health workers. Now, prevention and control of hepatitis. Viral hepatitis is a major global health threat causing 1.34 million deaths annually, with Pakistan and Egypt bearing 80% of the regional burden. In Pakistan, nearly 12 million people suffer from hepatitis B or C, with 150,000 new cases each year, primarily due to the unsafe medical practices and poor hygiene. So key challenges include inadequate data, unsafe injections, and limited access to treatment. So the response is led by provincial programs coordinated federally by the Pakistan Health Research Council with WHO and CDC support. Surveillance systems and national strategies are being strengthened to improve prevention, diagnosis, and treatment. Now, HIV/AIDS control program. Pakistan's HIV epidemic is concentrated with high prevalence among injecting drug users, sex workers, while general population prevalence remains low. WHO has supported national and provincial HIV/AIDS programs and through policy development, treatment access, and harm reduction services. There are 16 HIV treatment centers, 7 PMTCT centers, and free provision of antiretrovirals and diagnostic tests. Pakistan has secured over $100 million from the global funds to strengthen HIV prevention, treatment, and monitoring efforts. Moving on to maternal, newborn, and child health. In this regard, a technical staff is recruited by WHO in all 4 provinces of Pakistan at federal level to ensure effective coordination and collaboration, by which they are ensuring a quality care for maternal and newborn health, coordination with partners for family planning interventions, and capacity building on newborn and child health strategies, along with adaptation of global guidance on adolescent health and development, meanwhile generating the operational learning from integrated service delivery. WHO is partnering with UNICEF and UNFPA to support the Ministry of National Health Services regulation and coordination in developing a strategic framework on quality care to improve the quality of services for mothers and newborns in the country. Moving on to malaria and other vector-borne diseases control program. Malaria control efforts in Pakistan began in 1950, leading to near eradication by 1967, but resurgence occurred after premature withdrawal of efforts in 1969. Since 2002, WHO has supported national and provincial malarial programs through strategic planning, surveillance, capacity building, and new interventions. WHO has facilitated regional cooperation with Iran and Afghanistan via PIAM-NET for cross-border malarial control. It also supports integrated vector management to address multiple vector-borne diseases. Additionally, WHO aids in the safe disposal of obsolete pesticides and promotes rational pest control methods. And the aim is to invest in the future, defeat malaria in Pakistan. Now, polio eradication initiative. Unfortunately, Pakistan, along with Afghanistan, remains the last polio endemic countries in the world. WHO with UNICEF supports the government of Pakistan in polio eradication efforts to ensure that Pakistan achieves the polio-free status. Starting from the late 2018, Pakistan saw a resurgence of cases and increased the spread of polio. COVID-19 pandemic also posed challenges. So the program is mostly focusing on high-risk areas of core reservoirs, central Pakistan and South Khyber Pakhtunkhwa. TB control program. In alignment with the WHO and TB strategy, Pakistan's National TB Control Program developed a 2017-2020 strategic plan emphasizing partnership and multi-sectorial approaches. So the global funding providing $154 million under the new funding model supporting public and private sector TB programs. WHO and other partners assist in capacity building, MDR, TB management, program evaluation. So the National TB Control Program coordinates policies, donor engagement, and grant management. Private sector and community organizations play a role in TB case detection and management. So what is the Tobacco Free Initiative? WHO's Empower is a package of strategies and interventions to reverse the tobacco epidemic while using strict six strategies. M for monitor tobacco use and prevention policies. P for protect people from tobacco smoke. O for offer help to quit tobacco use. W for warn about the dangers of tobacco. E for enforce bans on tobacco advertisement, promotion, and sponsorship. And R for raise the taxes on tobacco. So what Pakistan's key achievements in terms of tobacco control are a notified pictorial health warning of 85% size on both sides of cigarette packs and outers have been done, ban on the sale of cigarettes to minors, ban on import of shisha, tobacco and non-tobacco and related substances, ban on smoking in places of public work or use, mandatory display of no smoking signs at public places, ban on manufacturing, importing and selling of cigarette packs having less than 20 cigarettes, ban on smoking in public service vehicles, ban on tobacco advertisements in print and electronic media, ban on free samples, cash rebates, discounts, and sponsorship of events. Now, WHO has some role in public health research in terms of it publishes the World Health Reports and Global Burden of Diseases. The World Health Report and Global Burden of Diseases study analyzes disease prevalence, mortality, and the risk factors worldwide. It also conducts the epidemiological research on disease outbreaks, understand risk factors, and guides interventions to control and prevent diseases globally. provides the guidelines on evidence-based health policies like disease control, vaccination, maternal and child health, and non-communicable disease prevention. WHO's role in disease prevention and control, it is responsible for surveillance and response for epidemics and pandemics like COVID-19, Ebola, Zika, immunization programs, for example, EPI, and research on emerging infections like Mpox, Ebola, and Zika, etc. Now, certain sustainable developmental goals, they are also being covered by WHO. So the WHO plays a crucial role in achieving this SDGs, which were adopted by UN in 2015 as a part of 2030 Agenda for Sustainable Development. These goals aim to improve global health, well-being, and socio-economic development. Mostly, the third point of the Sustainable Developmental Goals has been covered by WHO, which is ensure healthy lives and promotes well-being for all at all ages. Some other points that are being covered by WHO services are ensuring universal health coverage, combating communicable and non-communicable diseases, strengthening global health security, addressing environmental health, promoting mental health and well-being, reducing health inequality. There is one concept which has been introduced by WHO since 2022, which is One Health approach. The One Health approach by World Health Organization is a collaborative, multi-sectorial, and transdisciplinary strategy aimed at achieving optimal health outcomes by recognizing the interconnectedness of humans, animals, and the environment. This approach is essential for addressing global health threats such as zoonotic disease, antimicrobial resistance, food safety, and environmental health hazards. WHO's role in One Health is it has collaborations with FAO, OIE, and UNEP, who WHO partners with them and implement the One Health strategies. Global surveillance system, WHO leads initiatives such as the Global Early Warning Symptoms, which is GLUES, for tracking disease outbreaks, and also on policy and capacity building, which develops the guidelines and supports countries in strengthening health systems for One Health implementation. There are certain challenges that are being faced by WHO. Number one is global health inequalities, funding and resources constraints, emerging and re-emerging infectious diseases, political interference in health policies, vaccine hesitancy, and misinformation. So, moving on to the WHO's future directions. Number one is strengthening pandemic preparedness and response. Number two is enhancing digital health solutions and AI in healthcare. Number three is tackling antimicrobial resistance. And number four is expanding mental health and climate change initiatives in future. Now, moving on to the recent advances, this is the article which is published on the WHO site. One Health Joint Plan of Action 2022 to 2026, working together for the health of humans, animals, plants, and the environment. So overview, the quadripartite organizations, the Food and Agriculture Organization of the United Nations, FAO, the United Nations Environment Program, UNEP, and the World Organization for Animal Health, and the World Health Organization. They collaborate to drive the change and transformation required to mitigate the impact of current and future health challenges at the human animal plant environment interface at global, regional, and country level. Responding to the international requests to prevent future pandemics and to promote health sustainability through the One Health approach, the quadripartite has developed the One Health Joint Plan of Action 2022 to 2026. The OHJPA outlines the commitment of the four organizations to collectively advocate and support the implementation of One Health. It builds on, complements, and adds values to existing global and regional One Health and coordination initiative aimed at strengthening capacity to address complex multidimensional health risks with more resilient health systems at global, regional, and national levels. Another one is tobacco-free initiative in Pakistan. So the way forward is, it is now time for Pakistan to fully implement Empower strategies, particularly the tobacco control best buys, strict implementation of smoke-free laws, a comprehensive ban on tobacco advertisement, promotion, and sponsorship, implementing large-sized graphic health warnings on cigarette packs, introducing plain packaging, and raising tobacco taxation. WHO looks forward to the development of an evidence-based multi-sectorial plan of action for tobacco control in Pakistan that will pave the way to accelerating implementation of WHO FCTC and achieving the global target of 30% relative reduction in prevalence and current tobacco use in persons aged 15 years and above. Now, moving on to the MCQ section. Number one is, the World Health Organization has been actively working with countries to strengthen their healthcare system. In Pakistan, the government collaborates with WHO to improve maternal and child health services, control infectious diseases, and ensure access to essential medicine. Additionally, efforts are being made to reduce health inequalities and promote universal health coverage. Based on WHO's primary aims, which of the following best represents the main goal of this collaboration? Number A, providing financial aid to the healthcare workers. B, ensuring the highest possible level of health for all people. C, replacing the national health policy with WHO's global strategies. D, restricting private sector involvement in healthcare services. E, prioritizing treatment over disease prevention. Correct answer is B, ensuring highest possible level of health for all. Two, a newly appointed public health officer is trying to understand how the World Health Organization operates. While attending an international health summit, they learned that WHO has multiple governing bodies, including an assembly where all member states participate, an executive board that advises and implements, and secretariat that handles day-to-day operations. Based on this information, which of the following best describes the structure of WHO? A single governing body that directly controls all healthcare policies worldwide. B, a decentralized system where early country operates independently without WHO oversight. C, a hierarchical structure with the WHO Director General making all major decisions alone. D, a three-tiered system consisting of World Health Assembly, Executive Board, and Secretariat. E, a privately funded organization managed by pharmaceutical companies.
Answer is A.
No, the answer is Delta, a three-tiered system. 3, during a global health crisis, an outbreak of a novel virus
Would you please explain why the correct answer is different from the choice that the most of the students they have picked? Would you please elaborate it?
Yes, we have already discussed in the governance structure slide that there are three bodies in the structure of WHO. I'm going back to the slide where I have presented this concept.
ये please आप ना अपनी slide.
Yes, ma'am, I'm presenting this. This is the slide which shows that there is a three-tiered structure as WHO operates under a well-defined governance structure consisting of World Health Assembly, WHA, 2 Executive Board, EB, and 3 Director General. All the three, they implement policies and make decisions, which was discussed afterwards in the functions key responsibilities slides. Okay, during a global health crisis, an outbreak of a novel viral disease is reported in multiple countries. The World Health Organization immediately responds by coordinating international efforts, providing technical guidance, assisting in vaccine development, and supporting affected nations with resources and expertise. Based on this situation, which of the following best describes the core functions of WHO? A, directly treating patients in affected areas and managing hospitals worldwide. B, conducting political negotiations between countries to control health crises. C, coordinating international health responses, setting global health policies, and providing technical guidance. D, approving and distributing vaccines without scientific evaluation or regulation. E, operating as a for-profit organization selling medical supplies to member states.
C.
Yes, Charlie is the correct answer.
Really?
4, during a severe dengue outbreak in KPK, Pakistan, the World Health Organization, WHO, faces multiple challenges in coordinating an effective response. Despite WHO's technical support, the country struggles with inadequate healthcare infrastructure, lack of trained personnel, and vaccine hesitancy. Additionally, misinformation spreads rapidly on social media. Which of the following best represents a major challenge faced by WHO in this situation? WHO has unlimited authority over national health policies and can enforce measures without government approval. B, WHO is restricted by political, financial, and legislative barriers when implementing global health interventions. C, WHO is primarily responsible for treating individual patients rather than guiding public health strategies. D, WHO only works in developed countries and does not engage in low resource test settings. And E, WHO independently manufactures and distributes vaccines without national collaboration.
Beta.
Yes, beta is the correct answer.
B.
Yes, B. 5, in a South Asian country, the government has launched a national health insurance program to provide essential healthcare services to all citizens regardless of their financial status. However, rural communities still struggle to access the quality healthcare due to lack of hospitals, trained medical staff, etc. WHO is working with the government to strengthen the primary healthcare services and improve the financial protection for citizens. Which of the following best represents a key barrier to achieving universal health coverage in this scenario? A. High income groups benefiting more from the government health programs than low income groups. B. The lack of hospitals and trained healthcare professionals in rural areas. C. WHO's direct control over national healthcare policies. D. WHO prioritizing only communicable diseases and ignoring non-communicable diseases. E. The refusal of private hospitals to accept WHO funding.
Alpha.
No, it's beta, the lack of hospitals and trained healthcare professionals. Moving on to 6, Pakistan has experienced a sharp rise in dengue fever case due to increasing urbanization, poor waste management, and climate change. WHO is assisting government in implementing an integrated dengue control program, early case detection, and improved patient management. However, despite these efforts, outbreaks continue to occur due to low public participation in resource reduction activities and limited healthcare infrastructure in rural areas. Based on WHO's dengue control strategy, which of the following should be the most important next step to enhance the effectiveness of the program? A. Rely solely on vaccination programs and stop other control measures. B. Increase fogging and insecticide spraying in all urban and rural areas without monitoring the effectiveness. C. Strengthening the public engagement initiatives to improve community participation in mosquito breeding site elimination. D. Focus only on hospital-based dengue management and ignore prevention strategies. E. Encourage dengue patients to self-medicate instead of seeking medical care. Anyone?
C.
Yes, Charlie is the correct answer. 7. A public health crisis arises due to a sudden outbreak of a novel viral infection. The WHO Executive Board convenes an emergency meeting to advise on an international response. As part of its mandate, the board must make recommendations to the World Health Assembly regarding urgent policy measures. Which of the following actions would best reflect the role of the WHO Executive Board in this scenario? A. Implementing emergency health policies without consulting member states. B. Providing strategic guidance and recommending resolutions to the WHO for approval. C. Directly funding vaccine production. D. Dispatching WHO personnel to enforce quarantine measures worldwide. And E. Overruling national governments on disease containment policies.
B.
Yes, beta is the correct
C.
answer. B is the correct answer. 8. In Pakistan, increasing cases of drug-resistant infections have raised concerns about the misuse of antibiotics in both healthcare and livestock sectors. The WHO Antimicrobial Resistance Program is working with the Pakistani government to develop a national action plan to combat AMR. As part of this effort, WHO is promoting antibiotic stewardship programs, strengthening the surveillance and raising public awareness. Which of the following initiative best aligns with WHO's approach to address the AMR in Pakistan? A. Banning all antibiotic use in hospitals and livestock farming. B. Encouraging the unrestricted sale of antibiotics to ensure accessibility for all. C. Developing national guidelines for the rational use of antibiotics and implying the infection control measures. D. Relying solely on pharmaceutical companies to develop new antibiotics without regulating existing usage. And E. Leaving AMR management entirely to individual healthcare facilities without government oversight.
Charlie.
Yes, Charlie is the correct answer. 9. Despite significant efforts by WHO and government of Pakistan, polio virus transmission continues to be reported in certain regions. WHO-led polio eradication program faces multiple challenges, including vaccine refusal, security threats, misinformation, and difficulties in reaching remote areas. In some communities, false rumors about the vaccine causing infertility have led to resistance. Which of the following strategies would be the most effective in overcoming these challenges? A. Making polio vaccination mandatory by law without community engagement. B. Deploying security forces with vaccinators to force immunization in resistant communities. C. Improving awareness through religious and community leaders to address vaccine hesitancy. D. Halting the vaccination program in conflict affected areas to ensure worker safety. E. Providing polio vaccines only in hospitals and expecting parents to bring their children voluntarily.
Charlie.
The answer
Yes, Charlie is the correct answer. 10. Pakistan is facing a growing burden of tobacco-related diseases with high smoking prevalence among youth and adults. The WHO Framework Convention on Tobacco Control provides guidelines for reducing tobacco use through measures. However, enforcement remains a challenge. Which of the following intervention would be the most effective in strengthening Pakistan's tobacco control effort under WHO guidelines? Number A, banning all forms of tobacco sales immediately, regardless of public or industry resistance. B, reducing cigarette prices to make legal sales more competitive with illicit tobacco products. Increasing tobacco taxes, enforcing strict advertisement bans, and implementing graphic health warnings. Relying solely on individual willpower and voluntary quitting programs without policy interventions. E, allowing tobacco companies to self-regulate their marketing and sales practices. Yes, Charlie is the correct answer. So this is the key of the MCQs. Here are the references. And this is the link of the channel where the presentations are uploaded. Thank you.